First, it's important to cover the muscles of the iliac region. The origin of the psoas major is the transverse processes and bodies of L1 to L5, and the origin of the iliacus muscle is the iliac fossa and the ala of the sacrum. The iliacus inserts on the tendon of the psoas major, and together they insert into the lesser trochanter of the femur. The innervation of the iliacus is the femoral nerve from branches L2 and L3, and the psoas major is innervated by L1 to L3 branches. The psoas minor originates from the vertebral bodies of T12 and L1 and inserts on the pectineal line of the pubis. It's innervated by a branch of L1. The iliopsoas acts to flex the thigh and to flex the trunk of the body. The psoas minor also helps with flexion of the trunk, but it's a weaker muscle. Bursae are fluid-filled membranous sacs that help reduce friction during movement. The iliopsoas bursa is located behind the iliopsoas muscle. Its bursitis, inflammation of this bursa, is caused by repetitive movement of the iliopsoas muscle, injury, or inflammatory conditions. It is typically diagnosed through physical examination and an MRI, and treatments include NSAIDs physiotherapy and, in severe cases, draining. Since it's the largest bursa, its inflammation is associated with a lot of pain. Wonderful. Now let's move down to the anterior compartment of the thigh. Here we have the sartorius, the quadriceps femoris, which comprises the rectus femoris, vastus lateralis, medialis, and intermedius. We also have the articularis genus in this region. The sartorius originates from the anterior superior iliac spine and inserts on the medial surface of the tibia. The muscle is innervated by the femoral nerve from branches L2 and L3. Fun fact, it's the longest muscle of the body. The muscle inserts with two other muscles at the pes anserinus. The sartorius has many actions, including flexion, abduction, and lateral rotation of the thigh. It is also involved in flexion of the knee and medial rotation of the knee when flexed. The rectus femoris originates at the anterior inferior iliac spine and the ilium and inserts into the quadriceps tendon to patella and the patellar ligament to the tibial tuberosity. The rectus femoris is the only quadriceps muscle that crosses the hip joint. As a result, it is also involved in flexion of the thigh at the hip. The vastus medialis originates at the intertrochanteric line and the medial lip of the linea aspera. It inserts at the medial border of the patella and the patellar ligament to the tibial tuberosity. Deep to the rectus femoris is the vastus intermedius. It originates at the anterior and lateral upper two-thirds of the femur and has the same insertion as the rectus femoris. The vastus lateralis originates at the greater trochanter of the femur and the lateral lip of the linea aspera. It inserts at the same place as the vastus intermedius and rectus femoris. All the quadriceps muscles are involved in knee extension, as we can see here. The quadriceps tendon can tear, generally during injury. Symptoms include intense pain, bruising, swelling, and an inability to extend the knee. Treatment for a complete tear usually involves surgery. The quadriceps muscles are easy to remember because they are all innervated by the femoral nerve. They are vascularized by branches of the femoral artery. Now let's move on to the medial compartment of the thigh, also known as the adductor compartment. Groin injury is a tearing or strain of the origins of the adductor muscles of the thigh. This injury is common in quick start sports such as soccer and a 100-meter dash. All of the adductor muscles are involved in adduction of the thigh, as we can see here. The only one that is not involved in adduction is the obturator externus. The origin is from the margins of the obturator foramen and it inserts onto the trochanteric fossa of the femur. It laterally rotates the thigh and stabilizes the femur. Next we have the gracilis, which originates at the body and inferior ramus of the pubis and inserts at the superior medial surface of the tibia. Its actions on top of adduction of the thigh include flexion of the thigh and medial rotation of the knee. The pectineus originates at the pectineal line of the pubis and inserts on the pectineal line of the femur. It flexes the thigh and medially rotates the thigh. The adductor brevis originates at the pubic ramus below the pubic body and inserts on the medial lip of the femur of the linea aspera. It medially rotates and flexes the thigh at the hip. The adductor longus originates at the pubic body and inserts on the medial lip of the linea aspera. Its actions include medial rotation and flexion of the thigh. The adductor magnus has two parts, the adductor part and the hamstring part. The adductor part originates from the inferior ramus of the pubis and inserts at the medial lip of the linea aspera. It flexes the thigh. Finally, muscles in the medial compartment of the thigh are all innervated by the obturator nerve. However, the pectineus is innervated by the femoral nerve. The vascularization is the branches of the obturator artery. The femoral triangle is an anatomical space in the anterior thigh that is bounded by the inguinal ligament superiorly, the sartorius muscle laterally, and the adductor longus muscle medially. The floor of the triangle is formed by the iliopsoas, pectineus, and adductor longus. Meanwhile, the roof is formed by the fascia lata and skin of the thigh. The femoral triangle contains the femoral nerve, artery, vein, an empty space, and a lymph canal. The femoral sheath specifically encloses the artery, vein, and lymph canal. Finally, the adductor canal serves as a passageway. Thank you so much.